Good afternoon, everybody. Well, it's good afternoon here in sunny England. My name is Reid. I'm a professional officer and social worker at the British Association of Social Workers, also known as BASWA. I'm going to take you through a presentation over the next hour, which will look at anti-racism in social work specifically. I'm going to tell you a little bit about myself to begin with, and my history and my background in social work, and then I will tell you a little bit about my organisation, so you're clear on where we stand within the social work landscape within the UK, and then I'll go into my main presentation with regards to anti-racism. And as I say, all in all, it will be about an hour from now. So I hope that works for everybody. Okay, so here is the agenda that I will be covering. I've already mentioned a couple of things that I'm going to be talking about on there in terms of my social work background and the organisation that I work for. I'm going to talk a little bit about George Floyd's murder and its relevance to social work. I'll talk about Black Lives Matter and why that's relevant to social work, and also different organisational responses to anti-racism and the implementation of anti-racism in social work. And then at the end, there'll be opportunity for people to ask questions, and I'll invite those. Okay, so some information about myself. I began my career working for a private fostering agency. So by private, I mean an organisation that isn't provided by a public service. It's a private enterprise or a business, which is a large industry within England, where I live. I then worked for the probation service with adult offenders on an intensive supervision and surveillance program. And then I also then worked later on with young offenders under 18 within the court arena and as part of different community interventions, and specifically around sort of bail and remand and the period that young people are within the youth justice system prior to being sentenced. Okay, I also then went to work in adult mental health services. I worked in child protection. I've worked as a young person's advisor with care leavers, so young people leaving. I believe you call it the welfare state in the US. And then I also then went back to working in the private fostering sector. I worked for 8 years as a supervising social worker, so working with foster carers and supporting foster placements and everything that sort of goes with that. And that brings me to my current role at BASWA, the British Association of Social Workers, where I currently have a range of different roles. I noticed in some of the advertising for this event, it describes my role as a diversity officer. I think that was a slight error because it's actually a professional officer and social worker, as I was saying. So some of my areas look specifically at mental health, criminal justice, students and newly qualified social workers. I also support a number of branches, which will make more sense later on in my presentation. And various other work streams, including anti-racism, which is why I'm here today. Okay, so a little bit about my organisation, the British Association of Social Workers, abbreviated to BASWA. I am aware that you have another organisation in the US with the acronym of BASWA, but just to emphasise, we're the British Association of Social Workers. And we were established in 1970. We are a member-led organisation and we promote social work and the interests of those working within the profession and people using services. And we have roughly 21,000 members within England, Scotland, Wales and Northern Ireland. And just to emphasise, we are the strong independent voice of social work and social workers within the UK, and there are no other professional associations like us that exist, so we're quite unique. In terms of being the strong independent voice of social work and of social workers, here is just a few words which I'll not go into great detail on, but you'll be able to see for yourself exactly how we meet each of those objectives and the mandate that we have from our members. There will be a copy of this presentation available after today from the organizer. There are lots of live links which which will make sense later on in my presentation. By live links, I mean you can click on certain things within the presentation, and it will take you to different parts of the internet, which will evidence some of what I'm talking about. Okay, moving on. So very quickly, what BASWA, my organisation, does for social work. We host a framework called the Professional Capabilities Framework, which outlines different pathways and routes in terms of career progression for social workers. We host the Code of Ethics. We work with different employers and education providers and service user groups and different stakeholders nationally. And internationally, I might add as well, because we do have an affiliation with the International Federation of Social Workers. We have different branches and specialist groups, which I've already talked about. And we liaise with the regulator in England, which is a new regulator called Social Work England. We also work with different MPs, so politicians and civil servants, as well as various other things there that you can see that are listed in terms of what we do for social work. A quick list of now of what we do for social workers. We have different branches and networks across the country, which are made up of BASWA members who are all social workers at different stages of their career, all with very different backgrounds, different parts of the country, different specialisms, and so on. And then BASWA looks to bring those social workers together on different cross-cutting issues, some specialist issues as well, to champion the voice of social work. And there are some other activities that we provide and provisions we provide for members for social workers. We have a Black and Ethnic Minority Professionals Symposium group, which is a new group to BASWA, which I lead on, which is specifically made up of social workers from those backgrounds. And the intention, the objectives are for those social workers to have a safe online space to discuss some of the issues that they come across within their education and their work as students or social workers or newly qualified social workers and so on. As well as some of the other benefits there that you can see that we provide. And when you get your copy of this presentation, you'll see that these are some live links here where they are underlined, and those links will take you straight to different parts of the BASWA website and YouTube where you can get more information about my organisation. This page has a link to our events page. All of our events at the moment, because of COVID-19, are all online. So there wouldn't be any particular barrier to yourselves in the US or elsewhere in the world. So I know there are people joining internationally today. There would be nothing to stop you joining some of those events, dependent on the time difference. Okay, now I'm going to go into the main sort of feature presentation with regards to anti-racism. This first slide here gives you some idea of my approach to this, my perspective on some of the issues, and also it gives you some idea of BASWA as an organisation, how seriously they take, or how strongly we take anti-racism. So I hope that gives you a flavour of what's to come. I need to emphasize to begin with that this presentation is very much based on my perspective of anti-racism within social work. I've obviously developed that in conjunction with my organization, but I have to emphasize that a lot of this is personal and professional for me, being a Black British guy. There are very few male Black social workers, which you'll see on the slide there. There's a live link that will take you to some research around that specifically that might be of help to you or of interest to you. And also, my opinion cannot and should not be understood as representing the views of all Black and ethnic minority people or practitioners, social workers, and so on. We're not a homogeneous group. At that point, I am just going to elaborate slightly on the terminology of Black and ethnic minority professionals. I'm conscious that's probably not a term that you use in the US or elsewhere in the world, but it is a term that is quite a long-standing term within England, especially. Although we have moved to a term called BAME, which is an acronym for Black and Minority Ethnic, which I'm not a fan of myself, I have to say, and I do talk about that later on in the presentation. So I'll park that one for the moment. But just to say that in terms of Black and ethnic minority, what we're talking about is people of clearly Black heritage. So whether that be from Jamaica or Africa or other parts of Asia, for example. And by ethnic minority, really anybody who identifies as non-white, or who is visibly different, shall we say, in terms of society and appearance and so on. Okay. I also want to sort of emphasize that personally, I refuse to be the tokenistic Black voice of my organization. And that is something I've stated on many occasions in different articles, and there are links to some of my articles within the presentation, so I'll come on to those shortly. But this is something that I am quite clear about, that I'm not just kind of being wheeled out to tick a box somewhere for the organization. This is something that we do take seriously, and because I'm so passionate about it, and clearly it affects me personally and professionally, as I've said, it's something that I'm happy to lead on, and I do lead on. I've mentioned around, myself being one of many Black voices within social work already, and there is a link there to some research that I think will be helpful to you. And I also just want to close that slide by saying that I'm certainly no expert in organizational development or the configuration of organizations in terms of organizational leadership and so on. But I do consider myself as an expert with lived experience of personal and professional racism in life and in social work. So these are purely my perspectives from that point of view. Okay. The next slide outlines a timeline and different work streams that myself and my organization have worked on since May of this year, or between May and June specifically. So just to give some context as to how a lot of this work has come about from my organization and myself. So in May, when there was the Amy Cooper incident, which some of you, I'm sure a lot of you will be familiar with, in terms of overt racism and use of white privilege and so on. So there's a link there that will take you straight away to that incident if you're not familiar with it, or if you'd like to remind yourself about what happened there. That was just prior to George Floyd's murder, which I'm sure most, if not all, people will be aware of. And then following that, below it outlines the work that I've done and my organization have done in terms of campaigning and being active in this specific area of anti-racism within social work. So in June, I sent a number of tweets, or posted a number of tweets rather, around these issues. And I commented initially that it's very revealing to observe the indifference and silence and tokenism from some social work leaders, prominent social workers, and social work organizations during these times of serious racial violations. I see you, we all see you. And that was really the beginning, I guess, of my personal campaign around challenging some of this within social work. Again, if you click on the link there when you get your copy of this presentation, it will take you to that link, and you'll be able to follow then the sort of the trajectory of the work after that. I then sent a number of other tweets, which are all listed within that slide. And my organization then also issued a statement, a public statement, condemning the racist murder of George Floyd, condemning all forms of racism, sort of via Twitter, and the global Black Lives Matter protests then began across the world. Clearly, there are many within the US still ongoing, but also in other parts of the world as well. Within England specifically, there were then counter protests by far right and sort of white supremacist groups, and there were major clashes with the police. So again, there is a link to that. If you're not familiar with that in England, there's a chance that you might not be. BASWA, my organization, then developed an equality, diversity, and inclusion advisory group around that time. And I'm part of that group. We swiftly issued a position statement around not only the murder and condemnation of George Floyd, around his murder, but also outlining clearly as an organization what our position is on anti-racism within social work and what our future plans are in the short, medium, and long term. Around that time also, I became aware of a medal that is bestowed by the Queen of England, which is called the KCMG medal. Again, the link on the slide will take you to that, and you'll be able to see for yourself what that medal is all about. But the issue with that medal is that there's a very clear image of what looks like a white, blue-eyed angel with blonde hair, with its foot on the knee. Sorry, with its foot on the neck of what looks like a black man. So very much the kind of image of how George Floyd was murdered, but almost in a kind of Christian, kind of religious sort of visual way. And it emerged that this medal had been around for a long, long time within England. So when that came to my attention, that was something that I was very vocal about, again, online and within my organization. And my organization then issued an open letter to the Queen, which again, there's a link on there that will take you to the letter. Again, sort of asking for that image to be changed and explaining why we feel it's inappropriate. Okay, and the last couple of links on that slide are around an article that I wrote around that time, and that's called Black Lives Matter, Social Work Must Respond with Action, Not Platitudes. And again, there's a link there that will take you to that article if you want to read that. And then shortly after, I also wrote a poem, which is very much a nod to Gil Scott-Heron, for those of you who are familiar with him and his work with that title. On this next page is the actual image I was just referring to around the KCMG medal. Not sure how clear you'll be able to see that given this kind of this format, but again, if you have a look at my Twitter account, you'll be able to see it sort of bigger and expanded. So this slide outlines the work streams from July onwards to the present moment that myself and the organisation have been involved in with regards to anti-racism. So there was a second article that I had published, which is at the top, the web link for that, and that was around specifically how to promote an anti-racist culture in social work. So that I think is kind of universal and will be of relevance to students, to practitioners, managers, heads of service, and so on. There were also a number of podcasts that I was involved in. Again, the links there will take you to the different podcasts if you'd like to have a listen to some of those. And they all look at different aspects of anti-racism and how it relates to social work and how it's affected me both personally and professionally. We also developed the Black and Ethnic Minority Symposium that I mentioned, and again, there's a link there that will take you to that. I've mentioned about the BASWA EDI group, the advisory group, and we also have an anthology currently being developed, which will consist of stories, essays, and poems from Black and ethnic minority social workers specifically. And we hope to have that published by the end of the year. So that's very exciting. And there's been a number of different anti-racism presentations and workshops that we've been involved in. So as you can see, it's been busy times on various fronts of anti-racism. I can't possibly do it justice within an hour today, and hence why I've made some of these links live. But hopefully some of that resonates with you. Okay, so why was George Floyd's murder such a catalyst? Now, forgive me, this slide is a little bit wordy, but hopefully it conveys the message that I'm trying to put across, which is that George's murder was the latest in a long line of atrocities and brutalities endured by the global Black community. And this has a long history, longer than is sometimes convenient for honest acknowledgement. Some commentators refer to George's death, which is a dilution of what occurred. George was brutally murdered by a police officer, and the world has seen the evidence. The context to George's murder is emotive and cumulative. The Amy Cooper race grenade, which I referred to earlier, and again, there's a link there straight to that. Um, Endless examples of police brutality cases in the USA, but also in the UK. Modern day systems of oppression and the historic and ongoing suppression of the effects of slavery and colonialism in mainstream education. These factors accumulate and create an acute sense of anger and rage, and these emotions can manifest into civil disorder and criminality. It has been evidenced that the anarchic extremists are infiltrating protests to covertly fuel acts of looting and violence, which is then reported by the media in such ways to discredit the protesters. This detracts from the causal factors that have triggered the protests. And if we want to discuss looting, how about the long-standing looting of Africa's natural resources? And if you'd like to know more about what I mean about that, again, there's a live link there for you to click on when you get this presentation that will elaborate and expand further on that. Okay, so Black Lives Matter. Black Lives Matter, or BLM, is about Black lives needing to matter more than they have done, and society should apportion them equal weighting. And if you see the image there in my presentation to the right, hopefully that outlines clearly exactly what the message is. In England, I've come across the retort of white or all lives matter in response to BLM, but I don't feel it's comparable or relevant. And it's a little bit like asking, what about colon cancer during a discussion about breast cancer, or advising a bereaved mother that all lives matter at her child's funeral. And save the whales does not mean other sea life is unimportant. It's really about that equality, but also that understanding that up until this point, Black lives haven't mattered, and taking that seriously. White lives have always mattered, so to keep proclaiming white lives matter adds excessive value to them, tilting us further towards white supremacy. BLM has its critics, but it is unclear why a movement that promotes equality is demonized by some people who vehemently claim they are not a racist and advocate for freedom of speech. So it needs to work both ways, I believe, freedom of speech. Okay, what is anti-racism? Anti-racism is a belief that all races and ethnic groups are equal and deserving of the same opportunities. But the most important part of anti-racism is the next step, which is to do something about the existing inequality. Anti-racism is the active dismantling of systems, privileges, and everyday practices that reinforce and normalize the contemporary dimensions of white dominance. This, of course, also involves a critical understanding of the history of whiteness. And that paragraph is from Ibram X. Kendi, who is the author of How to Be an Anti-Racist, which is a very high-profile book at the moment with regards to anti-racism. So I'd recommend that. How is anti-racism relevant to social work? Now, this slide is very specific to England, where I live. And there's a comparison with the professional standards which we have for social workers in England from our regulator, Social Work England. So that's what this slide really denotes. But there are a number of other live links on there, particularly the ones at the bottom, that might be of interest to you when you get your copy of this presentation. You might just want to have a quick look at what those are now, just to kind of pique your interest. Okay, how much of a priority is anti-racism in social work? Really? Anti-racism in social work must be fully considered and dismantled through collaboration with Black and ethnic minority social workers in roles as experts with personal and professional lived experience. This is the only way that Black and ethnic minority social workers' basic needs can be properly met and their wide-ranging expertise fully utilised. Of course, this approach can only improve the experiences of Black and ethnic minority service users too. It really is just a question of how much of a priority is anti-racism in social work. And you will see that the graphic there to the side, and you'll have to forgive me because it was a screenshot I took on my phone, hence the time at the top. But it clearly outlines how it's not a level playing field. And actually, there's a number of obstacles faced by people of colour that aren't there for our white colleagues. And there needs to be more recognition of that globally, I believe. Okay, anti-racism, so what, blah, blah, yawn. If the news of police officers taking selfies beside the bodies of two murdered Black sisters, or the recent far-right violent protests in London, or the racist comments by councillors within a borough of England do not outrage you or alert you to the fact that racism is thriving within England right now, then you really must consider whether you have sleepwalked into being an opponent of anti-racism. Now, clearly, those links are to incidents that have happened in England, and we're all well aware that there are even graver examples within the USA, sort of past, present. But you get a sense there of what I'm talking about. That I do believe that there is a contingent of people out there who believe that this stuff is almost just sort of coincidental, that there aren't any kind of structural barriers, and quite clearly there are. At the very least, we must be self-aware and honest with ourselves and others when our boredom threshold is reached. Boredom can be subliminal and counterproductive to anti-racism at every level. Everyday microaggressions, including banter in the workplace. I'm not sure if banter is possibly a word that you use elsewhere in the world, but in England it means sort of having a laugh, a little bit maybe at somebody's expense, and that can vary from person to person and situation to situation. There's a link there anyway on banter within the presentation to kind of illuminate that for you. But everyday microaggressions, including banter, can fuel violent racist incidents. And I finished this slide with a few quotes at the bottom. The first being from Angela Davis, and I've added a slight bit here, so do bear with me. In a multifaceted racist society, it is not enough to be non-racist. We must be anti-racist. And I think there's a subtle but very important distinction between those two concepts of non-racism and anti-racism. Hopefully I illuminate that further in this presentation. The next quote is, being an ally doesn't necessarily mean you fully understand what it feels like to be oppressed. It means you are taking on the struggle as your own. The next quote is, the burden of ending racism should not be on those subjected to it, but on those who uphold and benefit from it. And the final quote is from Will Smith, Fresh Prince-esque. We do get that over here in England. Had it for many years. Big fan. His quote was, "Racism isn't getting worse; it's getting filmed." And of course, in the day and age that we are, with technology so easily and widely available, it has spotlighted issues like the murder of George Floyd in a way that we've not been able to do previously. Okay, so workplace racism. The covert, entrenched, and everyday racism in the workplace sometimes indicates the lack of quality, cultural diversity, and multicultural education and training available to all staff. So, not just administration staff, not just frontline social workers, but everybody within an organization. That I believe is the point that we need to get to. Surprisingly, it is rarely acknowledged in social work that race is simply a socially constructed idea with no scientific validity, invented and refined principally to oppress people of colour. This has modern day and everyday ramifications in the working environment. Black and ethnic minority practitioners have reported to my organisation, BASWA, that personal protective equipment during this COVID-19 pandemic has clearly been prioritised, stroke withheld on occasions for their white colleagues. Others explained they were made and ordered to visit service users with suspected COVID-19 with no PPE and no guidance or support, whilst white managers stayed at the office with their supply of PPE and engaged in racist banter. So these perverse experiences can be impossible for victims of naked and slippery everyday racism to articulate to others or reconcile internally themselves. Furthermore, these incidents are normalized and subsumed in many workplace cultures, with limited opportunities to professionally offload. And just thinking about the group I said I support at BASWA, the Black and Ethnic Minority Professional Symposium, BPS for short, that's one of the primary objectives, really, to provide a safe space for social workers from those backgrounds to be able to offload because they don't have it otherwise, generally. Okay, my next slide is an image, and I'd like you just to look at that for a moment and gather your thoughts. The next slide is an infographic. I hope the text isn't too small for you to read, but you will be able to look at this more closely when you get your copy of this. But it does define the terms around white supremacy, white indifference, white awareness, and white allyship really clearly, I believe. And it's something that you may be able to use within your studies as well, in terms of a point of reference, certainly within your practice and personally. The next image is a similar, provides similar information around different definitions of white identities. Again, a very good point of reference. This next image is a sort of infographic, and I have to say, I think every time I look at it, there's something new that I see in there that I think, oh, I didn't see that last time. But I really think it outlines the overt and covert nature of white supremacy really well, and how different elements of that are socially acceptable and unacceptable. Okay, key responsibilities. It's imperative that social workers evaluate their roles, moral and regulatory, in terms of their responsibilities. Current race relations require social workers to be proactive and do our homework to stay contemporarily astute as allies to Black and ethnic minority colleagues and service users. Black and ethnic minority social workers cannot and should not be expected to fix the racism in their workplace. However, those of us who are confident and capable enough with the right support, and I do think that's a massive point, the right support, not just thrust out and kind of told to get on with it. We can have a crucial role in educating, empowering, and equipping ourselves and potential allies and influencers to enhance and shape anti-racism initiatives in our workplace settings. Everyone has a duty to combat racism and other forms of discrimination. And I need to emphasize that also, that this isn't all about just sort of, race. It's about discrimination, full stop, and promoting equality. And I just happen to be talking about the racial aspects of that today. Everyone has a duty to combat racism in the spaces that they occupy, personally and professionally. And this includes reporting racist incidents when they occur, forming like-minded alliances with peers to tackle key issues, raising awareness, and making suggestions for positive reform. This presentation is primarily aimed at social workers, employers, educators, and key stakeholders. So that would include yourselves, of course. Barriers to meaningful organizational change. Before any meaningful change can be achieved, social work educators and employers must acknowledge the inherent and intrinsic nature of whiteness, white fragility, white privilege, and white supremacy as subconscious default positions in most, if not all, institutions, structures, and organizational cultures. It's a long sentence, that, but hopefully you get my point. There's a number of live links as well in that sentence, you'll see. Do have a look at those when you get your copy of this presentation, because it does clearly outline what those different concepts are. Individual and organizational awareness is an imperative first step for social workers, social work employers, and social work educators to address workplace racism effectively. And again, there's the quote there from Angela Davis with regards to being anti-racist. A few more images now, which will hopefully help you to gather your thoughts. I'm sorry if the writing is too small here, but this is what is called the pyramid of hate. And at the top, we have genocide. Below that, we have bias-motivated violence. Below that, discrimination. Below that, acts of violence. And below that, biased attitudes. So you can see how all of those different layers basically accumulate into a pyramid of hate. Again, worth looking at when you get your copy of this presentation. The next one is a similar one, but it looks at the different dimensions of institutional, structural, internalized, and interpersonal racism, called the 4 dimensions of racism. This next image I particularly like because it focuses specifically on the problem woman of color in the workplace and how women of color are problematized in the workplace. It clearly outlines how that works, what that is, and I'm sure lots of women of color out there will that will resonate perhaps with some of the experiences that they've had. Hope that's helpful. Okay, so 3 typical organizational responses when attempting to tackle racial inequality. So I've tried to summarize this really based on my experience. I've outlined to you what that is in terms of where I've worked in different social work settings. So based on my experience, my conversations, and the knowledge that I've accrued through that, I've come up with this summary. The first response from some organizations is to keep silent, to keep things the same, and just hope all this Black Lives Matter stuff just blows over. And this kind of inaction and paralysis of fear correlates with and reinforces perceptions of white fragility, white privilege, and white supremacy for some people of color. This type of organizational response usually commends staff for being resilient and deflects attention away from the essential redesign of systems that routinely make people suffer. The second response is for organizations to publish lukewarm organizational statements, that recycle and regurgitate previous rhetoric on workforce unity with predictable and borderline offensive platitudes, often proposing only superficial changes. For example, publishing a sympathetic but non-committal, knee-jerk, brief statement, possibly delegating responsibilities to an already overworked equalities officer or somebody with a similar title, and proposing minor changes to already vague policies and procedures on valuing diversity with little or no accountability. Approaches at this level are usually well-intended but tokenistic and overlook the nuanced obstacles and pitfalls that people of colour face every day. And unfortunately, this response is common. And finally, which I have to say I have seen some examples of in England, not lots, not as many as I would like, but I've certainly seen some examples of organisations publishing authentic anti-racism action plans, outlining significant reforms that commit to specific, measurable, achievable, and realistic targets. And there's some suggestions in the next slide, which I'll show you. I've seen organisations that have published strong mission or position statements condemning George Floyd's murder and racism in all its forms, and committing to my organisation's code of ethics, which I cited right at the beginning, anti-oppressive, anti-discriminatory, and anti-racist practice. This approach interlinks with the anti-racist commitment framework, and that's a framework which I've developed, which I'll show you on the next slide. The real acid test is to share this presentation with your social work leaders and see what response you get. I think that'll tell you which of those categories that they fall into. Here is the anti-racist commitment framework that I was talking about, which I've devised. I mean, it is very rough. I said before, I'm not an expert in organizational development or organizational leadership. I'd reiterate that now. But as I say, based on my experience and my observations, I believe that some of those things are realistic, they're achievable. They won't break the bank, they won't blow people's budgets. It really just requires organizational will. Here is another image about becoming an anti-racist and moving from the fear zone through the learning zone to the growth zone. What needs to happen nationally? Now, clearly, this slide is aimed specifically at England, where I'm from and where I practice as a social worker. But I do think there's still some relevance to people in other parts of the world. The existing national frameworks and initiatives to support Black and ethnic minority social workers are fragmented and optional. This can create confusion and dilution in their coherence and implementation in practice. Social work has a long history of committing to anti-discriminatory practice, but less in the way of practical, mandatory implementation or robust challenge on these issues. Now is the time for the profession. Obviously, I'm speaking nationally here with this particular slide when I devised it, but it's relevant, as I say, internationally. So, now is the time for the profession internationally to properly address this. I, and no doubt many others, would welcome the prioritization of sector leaders, including what we have over here as chief social workers, the regulator I mentioned before, Social Work England, and directors of social services and other key stakeholders to meaningfully and purposefully move this agenda forward to establish a mandatory anti-discriminatory national framework that is universal across social work, so across the different disciplines, children and families, adult social work, mental health, criminal justice, etc., etc. A universal mandatory framework in collaboration with my organisation. So that's something that we're hoping to push forward. An important first step would be to explicitly reintroduce anti-discriminatory, anti-oppressive practices and anti-racist values and ethics into the professional and qualifying education and training standards. Now you'll see that those are live links. Although they're specific to England, you might want to have a look at those just to compare and contrast with what you have elsewhere in the world. This new regime should involve partnership working between key stakeholders to enforce these values and ethics across the professional landscape. Key aims and objectives would be to ensure consistency, introduce mandatory requirements, emphasize anti-racist values and be universally applicable to all social workers, like the professional capabilities framework that I mentioned earlier and the professional standards are. We all know that organizations can sometimes be avoidant of anti-racism, but as social workers, we must recognize that silence or inaction on racism is complicity with the oppressors. Unfortunately, as a profession, we have been complacent and have much more to do to cultivate equality, diversity, and inclusion in the workplace and in society. I talked about BAME before when I was talking about terminology and how in England that is an acceptable term. It's used by most professionals across various different disciplines within social work, outside of social work, in the mainstream kind of vernacular. It's not a term that I like. Um, I'll not go into the rationale for that now because it'll probably take me too long. But just to quickly give you an overview of the BAME conundrum as I see it. So labels and terms such as Commonwealth and hostile environment and BAME, which are, as I say, acceptable terms within England and the UK, I believe need to be re-examined. BAME doesn't describe who I am as an individual. I believe that BAME is a clumsy, cluttered, and incoherent acronym that is opportune for categorizing people of colour as a homogeneous group when we are quite clearly not. And just to reiterate, BAME, the acronym, stands for Black and Minority Ethnic. So yeah, that's what it stands for. And as I say, I believe that that's about categorizing people really and nothing else. Of course, I can't speak for all people of color, and I understand that BAME can be operationally helpful in terms of sort of getting things done, and helpful when exploring the overarching effects of all things racist. However, it misses so much nuance and subtlety that it can be seized upon by those who wish to deny racism as a white problem. Routinely, I hear people comfortably stating that BAME people can't even agree amongst themselves. Um, this sloppy reductivism leads to terms being invented, such as black on black crime. But I've not heard about white on white crime ever. So again, that shows a kind of power imbalance there of how certain structures work. The next few slides are around what might an anti-racist working environment look like, and what can social work employers do to promote anti-racism in the workplace? What would the experience be like for Black and ethnic minority social workers? And I go into quite a bit of detail there within the presentation, which I'll not go into now, but I would encourage you to have a look at that when you get your copy of this presentation. But I will just go through the headings so you get an overview. So some of it is about recruitment, and it's about implementing recruitment targets, I believe, to ensure that there is a level playing field or a more level playing field. And there's a lot of proactivity around career progression for Black and ethnic minority senior leaders and educators. There's also the Rooney Rule, which I'm sure you'll probably be familiar with, for our colleagues in America, with regards to the American National Football League, where it derives from, which means that at least one person of colour candidate would be interviewed for each senior leader vacancy. There are some points around operations and some suggestions that I make around promoting anti-racism in that regard. To having a specific mission statement. I've included a good example, or what I believe to be a good example, how this can be included within policies and procedures, and so on. And with regards to what we call in England protected characteristics, so that would be people's ethnicity, gender, religion, sexuality, etc., that there are sufficient support systems and structures in place for them within the workplace, and they're not left to just kind of, manage themselves. I also suggest that there is adequate training for all staff, which I alluded to earlier around anti-racism. Moving on, annual ethnicity pay audits to ensure that any anomalies and discrepancies for Black and ethnic minority staff are properly reviewed and resolved. And again, something that I've come across in my career is where there has been a real disparity, really, between what people of colour and their white colleagues have been receiving in terms of remuneration and salaries, etc., with no justifiable reason, as far as I've seen. Okay, and also there is a COVID-19 risk assessment which my organisation BASWA have developed for social workers, which I believe should be utilised. I mean, you'll probably be aware of the current data around the impact on COVID-19 on Black and ethnic minority communities, that there is a kind of disproportionate effect. And so because of that, I believe there's an additional layer of protection and accountability that employers have. And that risk assessment helps to address that. Another factor would be around education. Anti-racist education is recognised as being at the heart of developing a more cultured and inclusive workforce and healthy workplace. That there's an emphasis to decolonize social work training programs with the input of Black and ethnic minority academics, social workers, and service users. That, for me, is genuine service user involvement, but also genuine involvement of people from Black and ethnic minority communities at all levels in terms of social work education. Anti-discriminatory, anti-oppressive, and anti-racist practice forms a fundamental and mandatory requirement of social workers' professional development and registration. So again, this is something that is written then into the very standards and frameworks that are used to measure social workers, and also for them to demonstrate their suitability to continue being registered and practicing as social workers. I also think it's important that the expertise of specialist external trainers and consultants is utilised. You know, there's a wealth of knowledge with regards to anti-racism globally across the whole world. We have some great anti-racist educators in England, in the UK that I've connected with. Also, I believe organisations need to utilise that expertise to show proper willingness and engagement in trying to combat racism. Allyship is also another key element. Anti-racist allyship, and there's a link there that will take you to a guide around allyship and what that will look like, and how different people's allyship journeys might progress, etc. So it's vital in understanding allyship, I think, by senior leaders, educators, practitioners, and so on. Educating, empowering, and equipping allies to actively support colleagues from marginalised and minority groups is common practice. So that this is all aspirational and idealistic stuff of where I would like anti-racism to be in terms of social work. Hopefully some of this is resonating. Allyship actively promotes ways in which managers and staff can become allies or become better allies to support their Black and ethnic minority colleagues. And employers and educators demonstrate they're willing to keep listening and learning to instigate meaningful change. The next slide is an image, and that outlines the 7 A's of authentic allyship. Another key aspect of this idealistic kind of safe haven of anti-racism that I'm visualizing is reverse mentoring. And so I outlined there what that entails. There is a link there also describing what reverse mentoring involves, but effectively it's about Black and ethnic minority social workers mentoring senior leaders and educators on anti-racism. But I do feel it's really important that there is a sort of signed consent from the outset to address issues of confidentiality, power dynamics, conflict resolution, and so on. Otherwise, it can be disempowering for that Black and ethnic minority worker potentially. And finally, leadership programs in terms of career progression. And there's some different ideas there that I've outlined in terms of what that might look like in terms of different development opportunities. That might involve shadowing, it might involve mentoring, nominations to comments, etc. But importantly, there needs to be a kind of ring-fenced investment and sufficient operational resources to support leadership programs to combat anti-racism in the workplace, or to promote anti-racism rather. And also, this addresses the lack of Black and ethnic minority social workers in senior roles and provides support for those who are. And that's very much the case within social work within England. That we find that the higher you go up within organisations, the less people of colour that you will see sort of at the top, really. And that's one way that we can look to address that. Here is another image, and it's what managers can do to change the culture of their organization. And thank you very much for listening. That is the end of my presentation. I will invite questions. Found one, okay. Okay, so the first question is, I see that you work in foster care. Do you find it hard to deal with the family and children? I don't work in foster care anymore. I work for this organisation, if you can see behind me, BASWA, and that will make sense when you get your copy of the presentation if you missed that at the beginning. But I have worked in foster care previously in my last role, where I worked there for 8 years. I I would say yes, there was elements of finding it challenging working with foster carers and children and young people, but there were some real rewards as well. And in my experience, social work is very much about personalities and relationships, and that was exemplified, very clearly in foster care, just how important people's personalities and their relationships are, and how compatible they are. And with some people, it's really easy. You get along from the start. Others, you feel like you're constantly having to work at that relationship because of their personality or because of your own. Yeah, there were lots of instances where I felt I had some massive wins in terms of outcomes for children and young people and what I was able to achieve for them and their foster families. But there were also other situations where, we had to deregister foster carers for safeguarding reasons or incompetence or significant incidents, and that can be quite traumatizing for them, the children, and everybody involved. Also, significant incidents of young people being involved in serious incidents, whether that be child exploitation, sexual, or in gangs or whatever, or drugs. And having to manage those. So, there was some real ups and downs, but I would say that overall it was something that I really enjoyed. And if it's something that you're interested in, I would encourage that. Very rewarding. I hope that answers your question. The next question I can see is, how can social workers build solidarity within the international BLM movement? That's a good question. I think one of the ways that can be done is through the International Federation of Social Workers, known as IFSWA, which you may or may not be familiar with. You might want to have a look online at IFSWA. My organisation, BASWA, is affiliated with them, and many other professional associations are across the world as well. I think that IFSWA, as a sort of central global body, perhaps would be able to facilitate some of that. And some of it also, I think, is about the emergence of different social media and platforms where we can connect without having to travel now. We're not even able to travel now, because of COVID, but kind of given the technology that's at our disposal, I think it's important for social workers to connect using the technology and push the movement forward that way. I'm certainly active on social media, but I know not all social workers are. So it is something I think that we perhaps need to reflect on as a profession and try and develop. Whilst I'm talking about social media, I will give you my Twitter handle just in case anybody would like to connect or view my profile, because there's some other interesting links on there. So my Twitter handle is @Wayne, which is WAYNE _Reid 79, and I will put that in the chat box actually, just so in case people have missed that, and just so you've got it to hand. I think I've just popped that in there, and I hope that answers the question about international solidarity. I'm going to scroll through some more. Forgive me if I miss your question. I'm really just looking at random here, and I've probably got about another 5 minutes before I need to end the presentation. But let me see what I can find. Okay, so I can see one from somebody called Evelyn. Hello, Evelyn. Do you see a difference between USA and England in racism? That's another good question. It's really interesting. Yes, I think is what is what I feel instinctively. I mean, obviously, a lot of the information I get about racism in America is from the media, sort of mainstream media, which we know can't always be trusted. And I think as social workers, we have to think critically and analytically around the information that we kind of absorb and that we expose ourselves to. So I am always a little bit cynical around some of the images and messages that I get from the US about different things. But certainly from what I've observed, George Floyd's murder and lots of others, I can remember listening to Ice Cube 20 years ago, maybe more, 25 years ago, pretty much saying the same stuff as what appears to be happening now in America. Same with Ice-T. I used to listen to him as well about police brutality and all this stuff. It's pretty much the same. It seems like very much the same situation to me, except now we have the technology at our disposal, as I was saying before, in terms of camera phones and so on, which means then that we're able to document it and distribute that and highlight and campaign and protest as we are doing. And I think there's a kind of role in the technology helping us to galvanize people around this issue and hopefully mobilize and properly eradicate it. But yeah, I think one of the key differences between USA and England, perhaps, is obviously the number of people, far greater numbers in the USA. And with that comes kind of more of a kind of a sort of ghettoization, I suppose, that it appears that there are pockets or large communities where Black people are almost segregated, whereas there's not as much of that in England. There is some examples of that, but not as much of that. And with that comes different forms of racism, I believe. So there are some key differences. Okay, I'll take one last question if there is one. Let me see. Okay, I like this question. It's from Brian Lindmood. I hope I've pronounced your name correctly, Brian. His question is, based on the science regarding our truly identical human race status, should the ideal educating everyone to the fact that there is only one human race or something like that? Slight typo there, which I think is corrected, but I hope you get the gist of the question. That basically, because there's identical status between human races, between whites and blacks and every other ethnic group, should we be working towards that one human race kind of philosophy and approach to all this? And my simple answer to that is yes. If we can get back to basics in that regard, I'd be very happy. And I think that could only lead to the road of equality, really. But we know that it's going to be far more complex than that, and there are lots of obstacles for us to overcome before we can get to that. So as simple or as simplistic as that is, and I agree with the what you've put forward, I think there's a lot we need to do to actually combat racism in the form of anti-racism, not just kind of being neutral to racism, but or kind of thinking it's somebody else's problem. But if everyone takes a position where, what have I done today, or what have I done this week, or what have I done this month around anti-racism? If there's that sort of approach, I think that can only lead to positive change. And that is the final question that I'm able to take this afternoon. I hope everybody got something from my presentation. Do speak to the organizer around getting your copy of the presentation. It will be in view only mode, so you won't be able to edit it or anything, but all the live links that I sort of alluded to earlier on. They'll all be available. And it's almost a kind of training course in of itself, the presentation. But I hope you got something from it. It's been a real pleasure this afternoon. Thank you for making the time to listen to me.